I have been occasionally passing stools with yellow lumps which resemble corn for the last couple of months. I also suffer from flatulence. I am a 19-year-old healthy male currently taking antibiotics for acne once a day. My mother suffers with celiac disease. Do I have this too, or what could it be?
Hello, this is Dr. David. I have read your question and am ready to help. The yellow lumps could just be mucus, which is normal to sometimes come out. If you have been on antibiotics, you might have developed a C. difficile infeciton in your bowels. A stool test for C. diff toxin can see if you are suffering from this infection. You can get testing for celiac spruce disorder as well. If you are able to eat gluten like in pizza and pasta and not have diarrhea, you most likely don't have coeliac disease. Had you in fact eaten corn in the few days before you passed these yellow lumps?
I do not eat corn.
What other symptoms do you have? You mentioned that you are taking something for irritable bowel?
Just an over-the-counter tablet that relieves symptoms such as bloating, flatulence. I am not prescribed these.
The symptoms that patients with celiac disease experience can be highly variable. Some patients experience bloating and flatulence, while others experience severe diarrhea, weight loss, etc. Since you are having these symptoms and have a family history, testing for celiac disease would be a very reasonable approach. Your GP could order some testing or refer you to a gastroenterologist for diagnostic testing. The two blood tests most frequently used for diagnosis are the tissue transglutaminase antibody, TTTG, and the endomysial antibody, EMA. If these two tests are negative, this would be strong evidence that you do not have celiac disease. You should know that these tests are less likely to be positive if you have been on a gluten-free diet before the test is done. You should be on a diet that does contain gluten before the test is done.
If it's not celiac disease, why could I be experiencing this?
Unfortunately, without an examination of the stool, it is very difficult to speculate on the specific nature of these lumps. A laboratory examination of a stool specimen that had these lumps would be the best first step in reaching a diagnosis. I would like to add that this is not C. difficile infection, and I don't agree with the first expert on that because this is not the usual presentation. I do agree that celiac disease should be tested with these symptoms. It is also important to note that pale, bulky, offensive stools can be due to malabsorption syndrome, and I will suggest having fecal fat analysis test for it. You need to see gastroenterologist and may require upper GI endoscopy. You can accept the second expert answer because his answer is right.
If you have a health question and want to chat with a doctor now, visit JustAnswer.com/ythealth.